Hello and welcome to Rising Kashmir. Following the deadly pandemic that has claimed over 1 lakh lives globally and 4 in Jammu and Kashmir, we are bringing you this exclusive interview of Dr. Naveed Nazir Shah, who is the head of the Department of Respiratory Medicine at Chest Disease Hospital in Srinagar. Since the pandemic, the hospital and its staff are at the forefront, fighting against all odds to save the human lives. Dr. Naveed, welcome.
Good morning.
Dr. Naveed, let me begin by asking you, what about the equipments? What about the equipments like PPE, the testing kits? Are they sufficient in numbers?
See, before the start of the outbreak in Jammu and Kashmir, the hospital administration as well as the government administration was already ready and prepared for it. If we talk about the facilities...
Prepared for it? What do you mean by prepared for it?
Prepared, I mean to say, before the first case was detected in UT of J&K, all the district hospitals or at primary health centers, isolation facilities were in place even before the detection of the first case. Our lab and the laboratory of SCIMS was already conducting tests way before the first case was detected, and even before when the first case was reported in our country. So we were already prepared in terms of testing, in terms of preparation of isolation facilities. Equipment wise, if I say, we are having ventilators at our place for complicated patients. There are around 16 in number, and in other hospitals like SCIMS, in SMHS, or even at district hospital level, there is an availability of a ventilator.
And what about the PPE kits?
See, we are having right now adequate number of PPE kits which are available for the doctors, the nursing staff, the paramedics, because the health of the medical staff is of paramount importance. If we don't take care of the healthcare staff, if God forbid some of them gets infected, it's going to pull the whole hospital staff into sort of a quarantine, and nobody will be able to cater to the needs of the patients. There are examples which we have seen outside where one healthcare worker is involved, he infects the others, and the whole hospital had to be closed for this purpose. But as of now, we are having adequate staff. We are being supplemented by different NGOs who are donating different kinds of material like masks, by PPE kits which have been routed through the district administration. And right as of now, we are having adequate stock. But we never know till what time this pandemic is going to last, and till what time we are going to get adequate quantity of the safety material. Now you will ask me...
How many ventilators?
Yes, I am coming to that. Right now, if we I'm talking about my hospital, there are around 16 ventilators which are at present functional in our hospital. But you can ask how many are needed. That nobody will be able to answer. If we compare our health system with the developed countries, say United States, Italy, Spain, they are considered to be having the best healthcare system in the world. And even their system was not able to cope up with the demand of the ventilators. So whatever is coming our way, we are taking that, we are trying to incorporate it. But how many ventilators should we ideally need? Nobody knows, because God forbid if the epidemic or the pandemic goes to such an extent, obviously the complicated cases will also increase, and at that point of time, any number of ventilators can be insufficient at any place in the world.
What about the oxygen cylinders?
Oxygen, see, in our hospital we are having an centralized oxygen supply. We were having, for all the wards, we dedicated one oxygen concentrator to the ICU where the ventilators are housed, and we have to get one more oxygen plant installed, which will be commissioned in 1 or 2 days, which will be fully functional in CD hospital. Apart from that,
what about its production capacity?
So we were already having around 500 liters one, and another one is
one is functional, right?
That was already functional. That was functional before. I'm coming to that. And another one which has been newly commissioned is also having a capacity of 500 liters. In addition to that, we have kept oxygen manifolds where we are having oxygen cylinders just in case of an massive outbreak. they will be able to suffice for the rest of the beds, and in case of any breakdown, an alternative arrangement in terms of that oxygen manifold which runs on oxygen cylinders, massive cylinders, that is already in place.
And how many tests you have done so far?
Tests, if we talk of our lab, which is run by the Department of Microbiology in CD Hospital, that's a BSL-3 lab. Around till date, I will say around 1300 samples have been taken, and they have been tested right now. But we need to test more. For that, we need additional equipment and additional manpower. That the concerned people are have already projected that, because there is a limit to the number of tests which can be conducted in one day, because there are a lot of steps which have to be performed for getting a confirmatory report. First has to be RNA extraction, then it has to be replicated, and then we get screening positive. Once a screening test comes out to be positive, then only a confirmation test is put. So there are multiple steps. What we suggested, that there are some machines where the turnover time of the test can be reduced. So if those kinds of machines are procured, the turnover time of a test can be reduced and more number of tests can be performed. In addition to that, the CBNAT or TrueNAT machines which were used for the detection of tuberculosis, they are being trying to be incorporated, and they are available at every district level. So if that is done, I think we'll be able to perform a lot number of
Given
tests.
the magnitude of the disease, how many tests should we be doing per day?
So there is no limit to the number of tests which should be conducted, but obviously we should conduct as many tests as possible, but keeping in view the capacity of the machines, that has to be taken into consideration, because there are prioritizations which have to be made while performing this test. For example, if the positive patients who are right now admitted in the hospitals or in isolation, they have to be given first priority. Then the contacts or immediate contacts or healthcare workers who are symptomatic, they have to be given a priority, and then on a massive screening purpose, that will come after that. But obviously, the more the number of tests we perform, the better it is, because we will be able to catch them early, isolate them, and we will the exponential rise of patients which can happen can be controlled in that way.
Do you use erythromycin and other anti-malaria drugs to treat the patients?
So see, there are guidelines which have been issued by Ministry of Health, Government of India. We have incorporated the same. We are giving those medicines to whosoever is indicated. But there are a lot of patients where we cannot give say this HCQS, hydroxychloroquine or chloroquine, because of cardiac complications. So we have to be guarded about that. So we see the magnitude of illness in the patients, and then we see for any contraindications, but we are following the Government of India guidelines, which are modified from time to time, and we are incorporating them in our treatment.
The state of Kerala is about to go for the plasma therapy. Are we going to see any same thing
See,
happening in
it's
Kashmir?
too early to say. We are in the process of doing it because it takes a lot of permissions we have to take. First step is the institution review board. We have to put it in there. Then we have to go for the permission from DGCA, and ICMR has to give a go ahead in terms of that. And second, then we were not in such a state, because plasma therapy is a sort of therapy where we have to take the plasma from the donors. So it's only those patients who are declared cured, who are said to have recovered from the disease, and then they should give consent. Or none of our patients has reached to that stage right now, but we have talked to them, whosoever is admitted with us. We have talked to them about this therapy, and as of now they are more than willing to donate the plasma. And then once we get the permission and they come to such a stage at what they are able to donate the plasma, once that stage comes, if we get the permissions, we are going to incorporate for use of it in those patients who really need it in the months to come.
Dr. Saab, there are also apprehensions that the disease spread through the air, through the atmosphere, we can say. Is it possible that it spreads through air?
See, as of now, evidence is there that the disease spreads by droplet infection and by fomites. Say, once you sneeze, when you cough, there's a definite range to what the virus spreads in the air. And second, and then if the virus goes onto some hard surface or wherever it is, if we touch that fomites can transmit the infection through hand, and then if we touch the mouth, it gets transmitted. And second is the aerosol generation. Aerosol is generated at definite places, like where we are nebulizing the patient, where we are doing some interventional procedures, we are intubating the patients, or we are doing some interventional procedures like bronchoscopies. At that place, there is aerosol generation. So at that place, there is a risk of transmission through the air. But there is no scientific evidence that the virus remains in the air for a pretty long period of time and or spreads through air to long far off places. There is no right now no scientific evidence of that right now.
Is there any possibility that a person can get the disease without having the likely symptoms of coughing, sneezing, or fever?
See, there's a sort of, one is infection, one is disease. Most of the patients who we are seeing right now are asymptomatic or rather having very less amount of symptoms.
Being asymptomatic, is it a worrying factor for us?
Yes, it is, because persons who are harboring this virus in themselves, if they have a good immune system, they may not develop symptoms at all. They will continue to spread the infection to the whole society, whereas they will be themselves asymptomatic. And God forbid, if the infection spreads from them to an immunocompromised person, the severity of illness can be more in them and can prove lethal in them. So all the patients we are seeing are in a sort of a denial mode, that we don't have any symptoms, we are not suffering the disease. One patient admitted with us clearly told that this is a wrong test, I'm not going to believe it. He was completely asymptomatic, but he was having a very high viral load, which was subsequently confirmed by another test. So people have to understand this, that they can be carriers, they can be harboring the virus, they can be infective in spite of being asymptomatic or even having very less amount of symptoms. So they have to be caught early, they have to be tested, they have to be isolated. That's how we can prevent the infection from spreading to far and wide.
Do goggles help in killing the virus?
No, there are a lot of myths which are associated with taking hot water and all that, which kills the virus. It's absolutely, there is no scientific evidence connected to it. Yes, if you can take a lot of vitamin C or vitamin D, that's a sort of an immunomodulator that can help us. Taking plenty of water is one factor which can boost our immune system, sort of a local immune system of the respiratory tract. They may be helpful, but there is no scientific evidence that these kinds of things really help us.
Doctor, what are the likely foods that we should take at home these days?
So there is no, this is a viral infection, the mode of transmission is known, there is no contraindication for any kind of food. Yes, once we get something from outside, it has to be properly washed. If there was a myth regarding taking of non-veg foods and vegetables which might transmit disease, it's not the per se the item which transmits. It should be washed properly. It should be, even if we take non-veg, it should be cooked properly. No raw foods have to be taken. It should be cooked properly, and every food is safe for any kind of person.
Has there been any case of relapse in Jammu and Kashmir as of now?
No, it's too early to state right now, because whatever patients we are having, we have not discharged any of the patients till now. They are still with us, and they have turned, most of them have turned from positive to negative. They are not harboring the virus right now, but there has been no discharge, so we cannot comment on that, whether there has been a relapse. Only I think in the whole state of in J&K, today, I think only six people have been declared. They have been discharged, or they are rather been said to have sort of, will not say cure, but they are free from the infection, and no evidence has come that there is a recurrence of the disease.
Dr. Saab, there are many complaints about the handling of these patients. Do you think that the patient, that the first victim from Hyderpora, was handled properly by the hospital authorities? Because
See,
there have been many stories
see
about the patient.
about the patient, there have been a lot of speculations that he has hidden travel history. I cannot comment on that,
But then they said that we had shown the entire travel history.
yeah, maybe I'm not sure, but ideally he should have been tested before from wherever
And
health.
whose fault was that?
No, I'm not nobody to comment or put the blame on anybody else. But if you see the documentation of the patient, it's quite well documented. The only thing was there that he was not tested. Whatever health facility he has gone, what documents I saw, that's a matter of.
But the authorities also have said to look into the case.
Yes, it's already under investigation, so it would not be appropriate for me to comment on that. But whatever documentations we have seen, in every document, he has been advised to go for home isolation or home quarantine. But you never know. The investigating authority is already investigating the matter, and they will come up with the facts.
Dr. Saab, my last question. Will we overcome this?
See, if we see the pandemic worldwide, even developed countries are not able to handle this amount of the magnitude of the disease. So we are, if we see right now at whatever stage we will say a sort of an early stage, and probably as of now we are seeing that we in subcontinent, I'll speak about my state, we are tolerating the disease better. I think so, because we are not having those severe cases as of now. But once the number increases, the number of complicated
And
cases.
are we ready for that if the number
That's what
increases?
I'm saying. See, if the number increases, obviously the number of complicated cases will also increase. And then comes the role of interventions and ventilators. And if it goes out of proportion, then for any health facility, it is not going to, the health facility is not going to suffice. So it is better to stop it at a preventive stage, stay home, stay safe, go for the administrative and health advisories, obey them, don't move out. If you have symptoms, contact the health facilities or helpline numbers. Don't hide your travel history. Don't hide your contact history. If we are going to isolate you or quarantine you at this stage, it will prevent the disease from spreading far and wide, and that will be in the interest of the patients and the society as a whole.
Thank you, Dr. Saab. Thank you for talking for Rising Kashmir.